Hello everyone. So you have been asking a lot of questions about your career in Australia, how to become a specialist once you start working here as a junior doctor. So in this video I'm going to tell you about your whole time frame, how much time it's going to take, what kind of exams you have to take. So listen carefully, and if you haven't subscribed to my channel, please subscribe now and press the bell icon. So let's say you are starting here as an RMO, which would be a PGY2 job. So internship is PGY1, and after that PGY2, PGY3 and so on. So if you are starting as an RMO, your first requirement is either you should have a general registration and PGY3 level of experience. So basically you have to work for 1 year at least in Australia as an RMO. You can start your training or apply for training in PGY3. Second, to get your general registration, there are two methods you can go, either AMC1 and WBA or AMC1 and AMC2. So these are the two criteria plus 1 year of work that I already mentioned. So now after 1 year, you got your general registration, you are applying for your medicine training. There is 100% selection rate in medicine training. So everybody who is applying for medicine, they are getting into medicine training. So now this is 3 years of medicine training, which we call BPT, Basic Physician Training. And during this training, you just have to work normally, regular working hours as before. Just a little bit of more teaching time when you are doing the training part, some assessments, and nothing very fancy, but yeah, you are getting paid. Nothing has been changed, just your designation. You are working as a registrar or SHO, and after 2 years, you can sit into your exam for your medicine BPT exams. There are two types of exam. One is MCQ, one is clinical. So first you sit into the MCQ exam with a average passing rate, and after few months you can sit into the clinical exam with a good passing rate, and then you can continue your medicine training for 1 more year. Or if you are not comfortable in after taking the exams after 2 years, you can wait for maybe 1 more year and then take the exam. But the good thing is, after 2 years, if you pass your exams, you have 1 year more as your basic physician training doctor to build your CV around the branch you would like to go into. For example, if you want to get into cardiology, gastro, rheumatology, you can do research, publish papers, attend some conferences, and it will build your CV around that branch. And now when we are talking about branches, there are different subspecialty branches, including intervention branches and non-interventional. Intervention branches are quite competitive. That's why you need some research or publications or attending conferences. But for non-interventional, not much of a fuss. You can easily get, for example, palliative care, geriatric medicine, and so on. Now, you have done your BPT, done with your exams, building your CV for your branch you love, and then you sit into interview. No exams for advanced training, that is subspecialty training. No exams, just interview based selection. And once you get into advanced training, you are working as a registrar. You don't have night duties. You will be on call, but you don't have to do the night duties anymore. You'll be getting paid well, and after 3 years there are no exams and you directly become a specialist in Australia. So there is only one time you have to sit into the exams to become a specialist in Australia, that is 2nd or 3rd year of your medicine BPT training. Now once you become a specialist, either you can work directly as a specialist, or some of the doctors, they like to be very specific. For example, if you have done gastroenterology and then you just want to work in IBD, so you can do 6 months or 1 year of fellowship in IBD, and you can see only the patients related to IBD and maybe very specific patients along with little bit of other gastro-hepat. So in Australia, once you become a specialist, that's totally up to you how specific you want to be, how specialized you want to be, but you are a specialist. And the rest of the things you already know, like how the life goes on afterwards. And yes, even from day 1 you come to Australia and start working, you are getting paid. Registration fee and everything is just negligible, not too much as compared to the salary that you are getting. So you will be independent, financially independent from day 1 when you come to Australia, provided you have some money, because the first salary comes after 2 to 3 weeks. So keep that in mind. Otherwise, no fuss, all good. And if you have any other doubts that I haven't touched during this video, please comment below and let's make a new video. All the best.